The goals of pediatric BLS training include initiating the chain of survival, learning CPR, and how to use an automated external defibrillator, or AED. The pediatric chain of survival in BLS focuses on preventing cardiac arrest, as breathing difficulties are more likely to induce cardiac arrest in children and infants. In this video, we will demonstrate how one rescuer responds to a limp or unresponsive infant in an emergency situation. Before initiating the chain of survival, a rescuer must first determine the scene's safety before approaching the infant during an emergency. It is important to ensure that both you and the infant are in a safe place, so quickly check for dangers such as fallen power lines, water, or traffic. Place the infant face up on a hard surface. Tap the bottom of the infant's foot and shout their name to determine if they are responsive. Check for vital signs. Observe the breathing patterns and pulse. Breathing patterns such as agonal or occasional gasping is not efficient breathing. Simultaneously check for a brachial pulse. Minimize interruptions for a minimum of 5 seconds and no longer than 10 seconds while checking for breathing and a pulse. If the infant is unresponsive without normal respirations, call emergency response and retrieve an AED. If alone, check for vital signs and perform 2 minutes of CPR if the pulse is weak before calling emergency services. Use your cell phone speaker to keep your hands free. Place 2 thumbs in the middle of the nipple line within the center of the chest, encircling the hands around the infant. Provide high-quality chest compressions of about 1.5 inches or 4 centimeters deep, or about 1/3 of the depth of the chest, at 100 to 120 compressions per minute. Allow the chest to recoil entirely between chest compressions to allow the heart to refill. Stop after 30 compressions and provide 2 rescue breaths. Place the pocket mask over the infant's nose and mouth to create a seal. Form a C shape on one side of the mask using one hand's thumb and index finger, and use the other fingers to gently lift the chin. Use the head tilt chin lift maneuver to open the airway. Attempt for a natural neck positioning and do not overextend. Use a jaw thrust maneuver if a neck injury is possible. Give a breath and deliver over 1 second while watching for the chest to rise. Repeat while giving a second breath. Return to providing chest compressions and minimizing interruptions during the transition. If the infant is still unresponsive, you may use an AED if available. If an AED is available, prepare the kit for use as quickly as possible to limit interruptions. If the infant pads overlap on the chest, place one at the center of the chest and one on the infant's back. Be sure to remove clothing to ensure good contact. Once they are placed, resume CPR until the AED prompts you. If the AED prompts a shock, keep hands clear and press the shock button. Perform the prompts and cycles accordingly until a PALS provider or EMS arrives, or the infant's condition normalizes.
If you enjoyed this video and would like to learn more, check out our MedicalProCerts video library on YouTube, or if you would like to certify in ACLS, BLS, PALS, or CPR, simply register and certify online today at www.medicalprocerts.com.